Hello everyone, welcome back to the channel Last Night Dentistry. Today we are going to discuss a very important and frequently asked topic in oral pathology and oral surgery known as Mucocele versus Ranula. Both are common reactive lesions caused by mucus escape from salivary glands. Mucocele is one of the most swellings in the Mucocele is one of the most common swellings in the oral cavity, especially in young patients. So, this topic is high yield for your BDS exams, FCPS exams, because examiners love to ask differences, clinical features, and management. Let's understand it step by step. Now, first, etiology and pathogenesis. The main cause is trauma to the salivary duct, usually from lip biting or cheek biting. When the duct is severed or injured, saliva continues to leak into the surrounding connective tissue and forms a pool of mucus. This is called mucus extravasation. There are two types: extra extravasation, which is most common, and retention due to blockage. Ranula is a special type of mucocele that occurs in the floor of the mouth from the sublingual gland. Now, moving on to the other slide. Now, let's discuss clinical feature of ordinary mucocele. Mucocele are most commonly seen on the lower lip, almost 80% of cases. They appear as small, dome-shaped, fluctuant, bluish, or translucent swellings. They are painless, soft, and mobile. Patients are usually children or young adults. The swelling may rupture and reoccur, showing fluctuation in size. If there is bleeding inside, it may look reddish purple like a hemangioma. Now, coming on the next is ranula, the special form of mucocele. Ranula occurs in the floor of the mouth, lateral to the midline. It has a characteristic frog's belly appearance, large, translucent, bluish swelling with visible blood vessels on the surface. When it extends through the mylohyoid muscle into the neck, it is called plunging ranula. This can cause neck swelling and, in severe cases, airway compromise. So, here is a quick comparison table that is very important for exams. Mucocele is commonly on the lower lip, small in size, from minor salivary glands. While on the other hand, ranula is in the floor of mouth, larger, from sublingual gland, and can be plunging type. Always remember the table: mucocele equals lip, while ranula equals floor of the mouth. Histopathology of both is almost the same. They are pseudocysts. There is no true epithelial lining. This is an important line. You see a pool of mucin surrounded by granulation tissue or fibrous wall. Foamy macrophages and neutrophils are present. The underlying salivary gland may show chronic inflammation and fibrosis. Diagnosis is the diagnosis and differential analysis we have. Diagnosis is mainly clinical, supported by a history of trauma. Aspiration shows thick mucus. Biopsy is done to rule out salivary gland tumors like mucoepidermoid carcinoma. Differentials include hemangioma, lymphangioma, dermoid cyst, and abscess. Now, coming to the treatment. For a simple mucocele, surgical excision of the lesion along with the feeder gland to prevent recurrence. While, in the contrast, for oral ranula, excision of the sublingual gland is preferred. Marsupialization is sometimes done, but it is not ideal. Plunging ranula needs urgent management, aspiration or surgery to prevent airway obstruction. Here are the high yield exam points. Most common site of mucocele is lower lip. Ranula clinical appearance, frog's belly. Histological nature, it's a pseudocyst, no epithelial lining. While the most important cause is trauma. Best way to reduce recurrence, remove the feeder gland. Complication of plunging ranula can lead to airway compromise. Always link mucocele with trauma history in exam. Now here is some revised questions we can see. Most common site for mucocele that can be a question is lower lip. A 15-year-old boy with bluish swelling in the floor of mouth, what could be the diagnosis? Yeah, ranula. Histopathology of mucocele shows. The answer is mucin pool without epithelial lining. It's a pseudocyst. Plunging ranula extends into neck through mylohyoid muscle. Treatment to prevent recurrence, excision of the lesions along with the feeder gland. These are the most repeated concepts. Practice them well. So that's all for today lecture on mucocele versus ranula. This topic is very important for both theory and practical exams. Revise these slides in comparison table regularly. If you found this helpful, please like, share and subscribe. Hit the bell icon and comment below which topic you want next. Share this video with your friends preparing for your BDS exam, ADC exams or FCPS exam. Thank you so much for watching. Keep studying hard and stay consistent. Take care. See you in the next video.